Thank you for joining us. I'm Liz Ernst, co-director along with Joe Benz for Protect Our Care Georgia. One thing is clear in 2020, healthcare is on the ballot. Healthcare is the number one issue on voters' minds, and today we are proud to bring you the Georgia stop of Protect Our Care's national Your Health, Your Vote tour, where we're out reminding Americans about the stark contrast between the Republican ongoing effort to rip away our health care and how Joe Biden and Georgia Democrats are fighting for lower costs and better care. Now let's hear from more of our speakers why this November your health is on the line. If you're joining us via Facebook Live, feel free to drop your questions for any of our speakers as a comment. And if you're in the Zoom call, please drop them as a chat box. We will be sharing our questions at the end of the remarks. So I'm so pleased to introduce our first speaker, Andy Slavitt. Andy is a senior policy advisor for the Bipartisan Policy Center and a member of its Future for Healthcare initiative. From 2015 to 2017, Andy served as the acting administrator for the Centers for Medicare and Medicaid Services. And a highlight of his tenure at CMS includes the successful execution of the Affordable Care Act. Welcome, Andy Slavitt.
Thank you. Thank you. I think these days my claim to fame is the greatest manipulator of the mute button. I'm getting it almost 50% right. Well, thanks everybody. Thanks for welcoming me. Let me just start with the situation that Georgians and all Americans are in today. People are going to bed at night, increasingly not sure whether or not they can afford to pay for their medicines if someone is to get sick. They're scared to go to the doctor. Emergency room bills cost more than the money they have in the bank, and they're not getting help from the place that they need it the most. In fact, at a time when Americans really need to rely on government, no matter what your political philosophy, the federal government is basically telling people, we just don't care. We just don't care enough because what little coverage healthcare you might have, we're going to make even more insecure, and we're going to try to take it away. Now we're in the middle of something that doesn't happen very often, an infectious disease that links all of us together. If your neighbor gets sick, it puts you at risk. So in this pandemic, we've seen millions and millions of people lose their health coverage, and they're less likely to go for health care. We've got millions of working people every day that don't have paid sick leave, so they have to show up for work every day. And of course, COVID-19 is one giant pre-existing condition because it affects every part of your body, even if you don't know it. Your heart, your lungs, your brain, your kidneys, your toes, your nose, your limbs, your circulatory system. So imagine folks getting COVID-19 today, even if they feel asymptomatic, a decade from now, if the Republicans have their way, then we're going to have insurance companies able to deny people any access to care because their entire body is going to be implicated by COVID-19. So in the face of all this, you would expect to have what? You'd expect to have some compassion, you'd expect to have some capability, you'd expect to have some leadership. Well, the good news is Americans can choose between two people who have a track record of overseeing a pandemic response. We've seen President Trump with COVID-19. We know how he's responded, how he's lied, how he's been negligent, how he's discounted our lives, how he's discounted the lives of older people. And Joe Biden. Joe Biden oversaw the COVID-19 response. I was there not the COVID-19 response, the Ebola response. I was there at the time, and I can tell you that he brings the core ingredients: compassion, commitment, competence. Joe Biden's the guy who would not go to sleep at night if nurses didn't have PPE. He would not let his head hit the pillow. Joe Biden's a guy that as long as Americans were feeling at risk anywhere, black, brown, white, green, blue, in jails, in farms, anywhere in the country, Joe Biden would feel it his personal commitment along with Kamala Harris to make sure that this was addressed. So we have a choice there. And it's not only there, and I'll make one final comment. The entire ballot is your verdict on hiring who you want. because right now we have a US Senate who is refusing to acknowledge that Americans are in great pain. And at the one time when we were in great pain, we've got senators that have decided they do have the time to rush through a judicial hearing. They do not have the time, nor do they want to provide unemployment insurance, help for renters, help for homeowners, help for anybody that has fallen on hard times during income supports. We need our country to be here for us during tough times, not stomp on us. So we need a different Senate. We need John Ossoff in the Senate. Quite honestly, this world would look a whole lot different with John in the Senate and with Joe in the White House. We can do that. We cannot do that by wishing it. We cannot do that by thinking about it. We cannot do that by complaining about it. We can do that at a minimum by voting, and at a maximum by getting everyone we know out to vote, and hire the right people. This is a hiring job. Hire the right people. It's as simple as that. Thank you for letting me make these comments.
Thank you, Andy. Really, really appreciate you being here. And now we'll hear from Cindy Pursley, who's zooming in from Noonan, Georgia. She's a 3-time cancer survivor as well as a stroke survivor. And after a 35-year career as a CPA, Cindy took early retirement in 2018 due to health issues and was able to do so because of the Affordable Care Act. And thank you so much, Cindy, for joining us.
Thank you, Liz. Hi, everyone. I'm Cindy Pursley, and as Liz said, I'm living in Georgia. I've been here for 23 years. I retired in 2018 due to health issues from 3 bouts of cancer, the ACA, and a stroke. The ACA allowed me to retire. I also have a genetic mutation which makes my whole body a pre-existing condition. I could get pancreatic and other cancers from this mutation. I just had a scare with my stomach, which thankfully came to nothing, but it required extra tests and therefore extra money. I need costly follow-up care such as regular MRIs and medication. Without the ACA, I would have no insurance unless I go back to work. I may have to go back to work if I'm still even able to work if the Supreme Court overturns the ACA. During the middle of a global pandemic that threatens millions of Americans' health, I feel like the Republicans and the Trump administration are still trying to take away my health care. It's callous and cruel to continue with this lawsuit amid our current health crisis. Americans are already worried about getting sick. They shouldn't have to worry about losing their health care too. This lawsuit spells devastation for millions of Georgians who rely on the ACA and would unleash chaos within our healthcare system at a time when we desperately need stability and support. We need Joe Biden in the White House and John Ossoff in the Senate, who will take this crisis seriously and protect our care. I know I can't afford 4 more years of Donald Trump and Senators Perdue and Loeffler. I hope voters who haven't voted yet will remember that all of our lives are literally on the line with this election. Thank you, and back to you, Liz.
Thanks, sorry, I was on mute. Appreciate you sharing your story with us, Cindy. It is a shame that Trump's actions to gut protections for pre-existing conditions have created so much additional stress while you're trying to take care of yourself and stay healthy, and for the millions of Georgians along with you. Now I'd like to introduce Reverend Leela Waller. She joins us from Kennesaw, Georgia. And for the past 27 years, Reverend Waller has been a spiritual and community leader and is currently a minister at the Turner Chapel AME Church in Marietta. Reverend Waller is one of the 342,000 Georgians infected with COVID. And as a type 1 diabetic, the virus effect has been particularly destructive. We so appreciate you being here today, Reverend Waller.
Thank you so much, Liz. Thank you for having me here this morning, and hello to all of you. I come to you this morning to say that our President, Donald Trump, and the administration has failed the American people in this pandemic. How can I say that? I say that because I am a coronavirus victim. Um, I was exposed to the virus in July, staying in the hospital for the first time for about a week, coming home, walking and thinking everything was okay. I was given steroids and I was given steroids and thinking that everything was okay. I was coming home to quarantine, but a few days later, I was struck with a stroke caused by COVID. I thought this was going to be my last breath. I have never experienced anything like it in my life. And I sat in the middle of the floor, not able to walk, room spinning, and I asked God, please not to take me by myself. However, I made it to the phone and was hospitalized for another almost 2 weeks. There is where they recognized that I had the stroke. I came home, I couldn't walk. I had to have physical therapy, and I'm not 100%, but I am getting stronger every day. But what really disturbs me is that this administration will not recognize or is insensitive to this pandemic. Just to think of him at the beginning, not recognizing that being real with the people, that this was a real pandemic, and saying to the people, not thinking they are intelligent enough to handle the real truth. And that caused us, I believe it has caused us lives. I believe it has cost us jobs. I believe it has cost us our health care. My friend that exposed me was with a group of veterans that got together to fellowship. He died. One of his other friends died. And once again, one of the other person there contracted the virus. I believe that Vice President Joe Biden will have a sensitivity and the morals and a plan to work on this virus. Once again, this president, as you can see, even after he said that he contracted it, his perspective have not changed. He is still not respecting the virus. And every time I see that, and he gather with folks without masks, what is it to just put on a mask and live life? But once again, this administration fails to recognize, fail to really look at this virus and be sensitive to how many people it has killed and how many lives have been changed. And so that's why I'm here today, that I believe that we need a moral leadership. We need moral leadership in the White House, a person that would be sensitive to the health of the country. And so it's time for a change, Liz. It's time for a change. Thank you so much.
Thank you so much, Reverend Waller, for taking the time to share with us your journey. And we hope that you continue to recover along with all of the families that have been devastated by this pandemic. Really appreciate you. Thank you so much. I'd now like to introduce Dr. Michelle Au, who is an anesthesiologist practicing for more than 10 years in the Metro Atlanta area. She also holds a master's in public health from Columbia, and she's running for Georgia State Senate in District 48, which includes parts of North Fulton and Gwinnett counties. Welcome, Dr. Michelle Au.
Thank you, Liz, for that intro. Again, my name is Dr. Michelle Au. I'm the Democratic nominee for Georgia State Senate in District 48. I'm also a physician anesthesiologist right here in Georgia in Metro Atlanta. So as an anesthesiologist, I take care of patients in the operating room, in the emergency rooms, and in the intensive care units. More recently, we've expanded our job description to include leadership of the emergency airway team, meaning that we get called to intubate COVID patients in critical respiratory failure. So the first thing I want to highlight today is the importance of healthcare access as a broader social issue and how vital it is to prioritize not just the health of individual patients, but of the community at large. I think the spread of COVID-19 really lays bare the fact that we do not live in a vacuum, right? It makes apparent that the health of an individual intimately depends on the health of the community around us. And that regardless of our personal resources, our environment, and our life choices, an individual will tend to have and lead a healthier life when the population around her is able to achieve that same goal. Now, there's an idea that's promulgated by our Republican colleagues that it costs society less money to limit spending on enhanced preventative care, or that it costs society less to avail more people of insurance coverage. And I can tell you for a fact that this is a fallacy, right? Because that saying, a penny of prevention is worth a pound of cure, is never more true when applied to public health. Availing more people of healthcare access and preventative care saves the system money, period. Every patient that we get in to see a primary care doc and put on cheap generic medications for hypertension could be one less patient that I need to rush to the emergency room and the operating room at 2 a.m. for catastrophic open heart surgery and months-long hospitalization in the ICU. Every patient that we can get hooked into the system for basic diabetes care could be one less patient I need to see in the ICU for dialysis access due to kidney failure, right? Every patient we get into the door for mental health services or recommended vaccinations or routine cancer screening is one less critically ill patient in our overburdened, under-resourced emergency departments, where they only receive costly stopgap treatments on problems that could have been avoided entirely if we just reached these patients sooner. Availing more people of healthcare access and preventative care saves the system money, period. And even more importantly than that, access and care saves lives. One thing that I will credit to COVID, and this is, a dubious credit, is that it's made all these points really glaringly obvious to everyone. Because at the hospital, we've seen firsthand how woefully underprepared the state of Georgia was for this pandemic, due in large part to the decisions of Governor Kemp and the Georgia Republicans. I know this to be true because I live through it every single day. Even before coronavirus, we were one of the sickest states in the nation with a high percentage uninsured, a threadbare public health infrastructure, and one of the few states who have persisted in refusing to fully expand Medicaid under the provisions of the Affordable Care Act. It didn't have to be like this. We could have done better. And at this point, it's unconscionable to refuse to try. On behalf of my patients and my colleagues who join me in caring for them, I say shame on the Republican leadership that's refused to do what's right for the people they serve. Senator Perdue, Senator Loeffler, Governor Kemp, President Trump, they prioritize partisan ideology above the health and lives of their constituents, refusing resources that are at our disposal simply to toe the party line as they personally luxuriate in the security of healthcare access many Georgians can only dream of. Shame on them. In medicine, we swear an oath, and that oath leads with this credo, which is first, do no harm. I only wish our Republican leaders were bound by these same principles. And I hope after November 3rd that we'll have some new leadership to replace them. So let's elect Joe Biden, let's elect Jon Ossoff, and let's elect Democrats all the way down the ballot. This year, vote as though your health depends on it, because here in Georgia, it does. Thank you, Liz.
Thank you, Dr. Michelle Au, for being a healthcare hero in and out of the hospital. Really appreciate you being here. And now we're going to turn to hear from Carolyn Stover. Carolyn is a recently retired marketing executive, mother and grandmother who is diagnosed with a rare lymphoma. And Carolyn has met with Senator Perdue's staff on a number of occasions since 2017, delivering hundreds of healthcare stories to the senator, urging him to act to protect Georgians' healthcare. So thank you, Carolyn, for joining us today and to share your story.
Thank you, Liz, and thank you, everyone. I'm really glad to be here to share my story, because what happened to me is what happens to millions of people. I got sick one day. I have lymphoma, and luckily I'm in remission, but I know that someday I may have to rely on doctors and hospitals again for treatment. while my diagnosis was a complete surprise, what I never expected was that I would find myself in a battle for my healthcare just because I have a medical history. But that's exactly what happened 3 years ago in 2017, when the Trump administration first tried to abolish the ACA. People like me were being penalized instead of protected because we have pre-existing conditions. And while that was bad enough, I saw that my own senator, David Perdue, was on Trump's side and not my side. And so again, 3 years ago, 2017, I started going to his office. I went dozens of times over the past few years to tell my personal healthcare story to his staff and appeal to him to protect the ACA. And over the past 3 years, there's actually been dozens of us, not just me, dozens of people who went in person to Perdue's office. And as Liz said, hundreds of other people who sent their stories in writing to Perdue. And over the years, what's happened, in telling him our stories, we were asking him to protect our healthcare. And we've seen that time and time again, he is on a course, along with the Trump administration, to sabotage our healthcare. And Perdue has failed to support legislation to protect us. That's the bottom line. That's what we've seen. Sadly, about 2 months ago, one of the women, a woman named Lori, who made the trip to Perdue's office several times, Lori passed away. And she passed away from an illness that would have been treatable if she had adequate health care. And what we couldn't get all these years by appealing in person to Senator Perdue, what we couldn't get done by asking him for help, we can now get done at the ballot box. By now, I really believe that voters no longer believe the lies from Senator Perdue that he stands for protecting pre-existing conditions. If Lori were here today, she would tell you that he's not. And I'm here to tell you that he's not. So that's my story. And thank you very much, Liz, for inviting me today to share my concerns.
Thank you so much, Carolyn, in sharing that really just tragic, heartbreaking story, and reminds us that Senator Perdue turns a deaf ear on Georgians with pre-existing conditions, despite what his fake ads may say. So thank you so much. Next, we are going to hear from our Congresswoman from the 6th District, Representative Lucy McBath. Unfortunately, Representative McBath was unable to join us, but because protecting healthcare is so close to her heart, she wanted to share the following recorded remarks.
Hi, I'm Congresswoman Lucy McBath, and I represent Georgia's 6th Congressional District. This pandemic has shown once again that every American needs access to quality, affordable health care. As a 2-time breast cancer survivor, I live with a pre-existing condition every single day, and there are over 300,000 people in my district that live with them as well. I was lucky. I had access to good quality health care, and all I had to worry about was just getting better. Far too many Americans don't have that luxury and are forced to choose between paying their bills or affording their treatment. During my time in Congress, I fought to strengthen the Affordable Care Act and protect the health care of almost 25 million Americans. I voted to lower the cost of prescription drugs like insulin, and I've worked hard to protect the coverage of the 135 million Americans who live with pre-existing conditions every single day. Together, we can ensure everyone has access to quality, affordable health care, and we can fight so that families can afford their prescription drugs. And we can protect those who have pre-existing conditions. Thank you all for joining us today, and thank you for continuing to fight to protect our care. Thank you, and God bless.
Thank you so much. As a resident in her district, I'm so appreciative of her hard work fighting for healthcare in Congress. And lastly, I'm so pleased to introduce the Democratic nominee for U.S. Senate, Jon Ossoff. Jon is a media executive, an investigative journalist, and a small business owner who supports the Strengthened Affordable Care Act and protections with pre-existing conditions alongside his wife, Alicia, who is an OBGYN physician in Atlanta. Welcome, Jon.
Thank you so much, Liz. I appreciate it. And thank you, Andy, for joining us. It's an honor to be here with you. Thank you, Cindy, for sharing your personal story. Reverend, thank you for being here. Michelle and Caroline, thank you for joining us. And Dr. Al, I want to thank you for your heroism. It's been medical professionals, public health professionals, nurses and doctors like you and like my wife, Alicia, who have done their jobs during this crisis. It's politicians who are failing us. Politicians who, even in the middle of a crisis like this, are so beholden to their donors in the insurance and pharmaceutical industries that they continue to push an agenda that would take healthcare away from ordinary people in the middle of a pandemic. It's a testament to the depth of corruption in Washington that someone like Senator Perdue, a senator who hadn't held a single public town hall meeting in 6 years, but who sells meetings for corporate PAC checks, is still supporting efforts to repeal the ACA's protections for Georgians with pre-existing conditions, even in the middle of the worst public health crisis in generations. Not only that he is still pushing efforts to repeal protections for pre-existing conditions, but that he takes to the airwaves and spends millions of dollars blatantly lying about his own voting record on this issue. Georgia's US Senator David Perdue, heavily funded by the insurance industry, carrying water for the insurance industry on Capitol Hill, voting to deny Georgians vital protections for our health, then taking his ill-gotten gains funded by the insurance industry to run ads to deceive his own constituents about his record on healthcare. This is about our family's health. There is nothing more important in our lives than our health and the health of our loved ones. And doctors like my wife, Alicia, they see every day at the hospital how many patients struggle to afford their care, how many patients are reluctant to even ask for a diagnosis because they fear that that diagnosis could imperil their insurance or could be the first step toward bankruptcy for their family. It doesn't have to be this way. We have the wealth as a country, we have the public will, the political will to make affordable, accessible healthcare a simple, reassuring reality for every single family. So this is no longer something that families have to lie awake at night worrying about. That is what I will fight for in the US Senate. I will stand with the people of this state, Georgia families, public health, the health of ordinary people, over the corrupt influence of insurance and drug companies who want to rip us off and deny us care just to pad their bottom line. So I'm grateful to all of you for joining today, for sharing your powerful stories. Liz, thank you so much for moderating the discussion. Andy, thank you for your tireless, I don't know when you sleep, Andy, but thank you for your tireless and omnipresent advocacy and all the information that you help push out into the public domain. And I wish all of you good health and grateful for your help.
Thank you so much, Jon. Really appreciate how you will tirelessly work to protect our pre-existing conditions and also fight for affordable quality healthcare in the Senate. Now I'd like to turn over the Q&A portion of our conference to Mika Heyer. Mika, could you please remind viewers how they can ask our speakers questions? Thank you.
Yes, thank you, Liz, and thank you to all of our panelists and to our audience today for joining. If you would like to ask a question to one of our panelists, please state who you would like to direct the question to and use the chat box. Or if you're joining us on Facebook Live, please leave a question in the comments now. Again, if you would like to ask a question, please enter it into the chat box or into the comments now. Our first question is actually an online submission for John, which asks, what does the accelerated timeline to confirm Amy Coney Barrett as Supreme Court Justice say about the Senate Republicans' priorities during a national health crisis?
Well, let's talk about the Senate's priorities. I mean, this is shocking. This is everything that's wrong with Washington. It was in August that emergency small business lending, extended unemployment insurance were expiring, that Georgia's schools needed help meeting CDC public health guidelines to reopening or investing in remote education so that young people could still access education during this crisis. That was in August. The Senate took a month-long vacation in August. Now we're in mid-October, and they still haven't passed additional economic relief for ordinary people and small businesses. Recall that Senator Perdue was one of those few senators who actually went out of his way to express opposition to even a single $1,200 relief check for workers in Georgia. He was leading the charge on Capitol Hill to cut unemployment insurance in the middle of this pandemic. Because David Perdue doesn't care about ordinary people. That's not who butters his bread. He cares about his donors, the insurance companies who pay him big money to buy his allegiance. And now, here we are still in the middle of this crisis, well into October. The Senate has not passed additional relief, and they're rushing forward with this judicial confirmation, and everybody knows why. It's because the Supreme Court will be hearing oral arguments on the repeal of the Affordable Care Act just days after this election. And it has been their preoccupation, their obsession for a decade to repeal this legislation so that their patrons in the insurance industry aren't encumbered by protections for ordinary people. That is why they are prioritizing this judicial confirmation process just days before an election, when Senator Perdue was adamant 4 years ago in floor speech after floor speech in the Senate that no judicial confirmation should proceed in a presidential election year. He's thrown those so-called principles out the window to rush through this confirmation to attack the ACA and undermine healthcare for ordinary people in the middle of a public health crisis, and it's shameful.
Yeah, absolutely agree. Thank you so much for your comments there.
Thank you.
This second question is actually for Andy. If the Affordable Care Act is eliminated in November, how could those with pre-existing conditions, including those who have had COVID-19 and are now suffering longer-term health consequences, be affected?
Well, look, let's start with this. The one thing you can do if you're worried about the court case is a Democratic sweep up and down the ballot. That is the one thing you can do, because with Joe Biden as president, with a Senator John Ossoff in the majority, they will, it's the only way to address what the court does in Congress. Without that, without a Senate majority or without a Democratic president, then we'll be in a situation where, unfortunately, we will be rolling the clock back to the way things used to be. And let me just paint a little bit of a picture for those of you who don't remember. Before the ACA, if you got sick, your smartest thing you could do was just make sure nobody knew about it. Because if they did know about it, it would likely mean you couldn't get insurance. Now think about that during a pandemic. Think about what we need to do to control the pandemic is having people take tests, contact tracing. Who's going to agree to a test to tell someone that they have COVID-19? Who's going to agree to do contact tracing so that other people might not be able to get insurance again? So imagine trying to control this pandemic in a world in which the Supreme Court does that. And of course, when we grew up, our parents and grandparents, often they worked in one job their whole career. But our kids, it's different. They go from job to job. Many of them have multiple types of jobs. Their employers don't offer them insurance anymore. And of course, in hard times like the pandemic, they get let go. So what we're getting told, let me just be very explicit. What we're getting told is those people don't deserve health care. Just be very clear about it. President Trump and the Republican Senate is saying, sorry, you're not worthy of health care. You didn't earn it. You didn't earn it by being employed by the right people, by living in the right place, by looking the right way, by some act that you should do to deserve getting health care. And if you happen to be sick or have been sick, like we have heard from Cindy and others, that is the wrong message. Is that what we want Cindy to understand? That she's not worthy? Hell no. Hell no. That's not who this country is. And it's very simple. We can elect a president, we can elect a senator, we can elect people all the way down the ballot who will send the right message of who we are and change this country. We have to have accountability now for the people who've made these decisions, for the people who've sent these messages, for the people who are destroying people's lives. Otherwise, I think to the point of the question, we haven't seen anything yet. It's going to be worse. It's going to be far worse.
Thank you so much for your comments there. This next question is for Dr. Au. Democrats in Georgia think that they have a chance to take control of the state house, but taking control of the state Senate seems less likely and will still have a Republican governor. What can you do as a member of the minority party in the state Senate to push for Medicaid expansion as called for in the ACA?
So thank you so much for that question. And obviously, it's true that in this current election in Georgia, there is a lot of focus on taking back the state house because we would just need to flip, not to say just, but 16 seats in the state house in order to take that chamber back for the Democrats. Now, the thing about the state Senate and the fact of the Republican majority is that it's a little bit fatalistic to say, well, even if we elect more Democrats, the Republicans will continue to hold the majority and we won't be able to get anything done, okay? That's basically an argument. Implicit in that argument is that the status quo is immutable. I don't believe that to be the case. I think change happens bit by bit, person by person. And by getting more people like myself and my other Democratic colleagues elected, we can continue to work in a bipartisan way using science, fact, and data in order to drive the change that we want to see, even in the state of Georgia, even with a Republican majority, because like I said, change happens bit by bit. Just look at Representative McBath's seat that was formerly held by a Republican majority leader also, and look at how much change we've seen over the past 4, 6, 10 years. This was Tom Price's seat. Lucy McBath sits there now, right? This is how change happens. This is how we do it, one person at a time, one vote at a time. So I really encourage voters to turn out for this election and vote for the change you want to see.
Sorry, if I can just throw one thing in to
Absolutely.
this. What you said, Doctor, is so correct. But people also listen to the will of the voters. People see the writing on the wall. That's how minds change. Doctor, I was so correct about this. Is it doesn't feel like it when you're looking at it because everything happens really slowly. But what happens when things break through, when things change, it's because imagine you're sitting there in the Senate, in the state Senate, and the House flips based on this. That is a message that people are out of step. And at its heart, people's healthcare is not a Democratic issue. People's healthcare is a personal issue. Democrats understand that better than Republicans. But as soon as Republicans understood that, Democrats would jump for joy and welcome them over the fence. So if you tell your elected representatives that this matters to you, by voting, by how you vote, you will persuade other people that they can't stand on this island anymore.
Thank you so much for your comments. Well, I do not see any other questions at this time. So Liz, I'll pass it back to you.
Great. Thank you so very much for joining us for the Georgia stop of Protect Our Care's National Your Health, Your Vote tour. We're so grateful to our speakers for sharing us with the stark contrast, excuse me, the stark contrast between Trump and his Republican enablers agenda to take away your health care and Vice President Biden and Georgia Democrats planned for lowering costs and better care. Y'all have given some compelling evidence why this November our healthcare is truly on the line. So please vote early until October 30th, and be well, stay safe, and goodbye.